Thank you for your patience, and I express my regret for arriving a bit late. But I'm Congresswoman Yvette D. Clarke, and I proudly represent New York's 9th District, which is Central and Southwest Brooklyn. Before I begin, I'd like to thank Congresswoman Shontel Brown and my other colleagues standing with us from the Congressional Caucus on Black Women and Girls, Congresswoman Bonnie Watson-Coleman of New Jersey and Congresswoman Robin Kelly of Illinois, for joining me in introducing the Uterine Cancer Study Act, a vital piece of legislation that will create a path toward more informed choices and better health outcomes for Black women. I'd also like to thank, again, my colleagues of the Congressional Caucus on Black Women and Girls, Representatives Bonnie Watson-Coleman and Robin Kelly, for showing their support for this bill and standing with us in solidarity during this press conference. Today we introduce the Uterine Cancer Study Act. This bill would require the Department of Health and Human Services and the Food and Drug Administration and the National Institute for Health to coordinate and conduct a study on the relationship between hair straighteners and uterine cancer. Recent studies have discovered that Black women who used chemical hair straightening products were at a higher risk for uterine cancer than those who did not. Like many other Black women who have used hair straightening products, I was unaware of the potential connection and harmful impacts these chemicals would have on our overall health, putting me and other women of color at higher risk for uterine cancer. Uterine cancer is the most common cancer related to the female reproductive system. In fact, the American Cancer Society estimates that over 67,880 new cases of uterine cancer will be diagnosed in 2024. And of that number, over 13,250 women will die from this variant, potentially putting Black women at a higher risk of uterine cancer due to their common practice of using hair straighteners. In Congress, my mission is the same. I'm focused on laws that target the disparities harming our communities and affecting Black women's health. So many of our Black sisters continue to use hair straighteners to hide their true hair textures in the workplace and from society for acceptance. And as they continue to use these products, we don't know the lasting impact that harmful chemicals will have on their health. That is why this legislation is crucial in holding chemical hair straightening companies accountable by ensuring our federal agencies coordinate to review significant findings and recommendations from other studies regarding the relationship between hair straighteners and uterine cancer. Consider the impacts on women and other individuals at risk of uterine cancer. Disaggregate the study that results according to whether the hair straighteners contain dyes or color or bleach highlights or perms. Determine whether the FDA should impose additional testing requirements on manufacturers of hair straightening products. And finally, focus on the increased incidence of such cancer among women of color. This legislation is a key step to informing Black women of the potentially harmful impact of hair straighteners. This bill could save lives, and I am proud to have introduced it. In closing, I want to thank each of my colleagues for their support and for Congresswoman Shontel Brown for her insight as a collaborator on this bill. I now ask my friend and colleague, Representative Brown, to come and to share her insights with you today. Thank you.
Thank you, Congresswoman Clarke, and I am proud to join Congresswoman Clarke on the Uterine Cancer Study Act and grateful for all of her work and the work of my colleagues in support of women's health, especially Black women's health. Earlier this year, I introduced the U-Fight Act with Congresswoman Clarke's support. This legislation will authorize research, screening, and treatment for uterine fibroids. And the connection between that bill and this one that we are announcing today is not that it's just the same part of the body. It's that those are very common and very serious conditions impacting women and disproportionately Black women. These are issues that we just are not adequately addressing. As women, this is something that we see time and time again. That's why we need this legislation, to make the research that we need to make happen. The statistics on uterine cancer are alarming. It's the most common female reproductive cancer. There are 60,000 new cases each year, and sadly more than 13,000 result in deaths. And here's what's really scary. The uterine cancer is becoming more prevalent. And it's one of very few diseases that also is becoming more deadly. And once again, black women. Black women are more likely to have this cancer and more likely to die from it. This is why so many of us are concerned about certain chemicals in hair relaxers and straighteners. Research is showing that these products that are used by black women are dangerous and linking them to cancer. Last year, I called on the FDA to take action, urging them to do the research and get dangerous products off the shelves and out of salons. And I've been supportive of their proposal to ban products that contain formaldehyde. But as of today, the FDA proposal has not gone into effect, and there are a lot more chemicals in these products than just formaldehyde. That's why we need this bill, to direct HHS, to direct FDA, and to direct NIH to study what's happening, review the existing data, and importantly, investigate why uterine cancer rates and deaths for black women are going up. Finally, as black women, our hair and how we wear it is such a big part of our lives. It's something that connects us. It's part of our upbringing. It's something that brings us together through community. And sadly, black women have experienced discrimination related to our hair. Mixed up in all that are the pressures and emotions and experience are all these products. To think that these products our mothers use, or that our sisters and our friends or even ourselves are still using, to think that they could be this dangerous, that is really troubling. We need answers, we need action, and we need this legislation. And with that, I want to call up my good friend from New Jersey, the Congresswoman Bonnie Watson Coleman. Okay, I got it.
Well, I'm really glad to be here with everyone. I want to thank Reps Brown and my fellow co-chairs on the Caucus of Black Women and Girls, particularly Rep Clarke, because she sponsored this bill, and Rep Kelly, because we try to stand together around issues that are impacting black women and girls. As some of you gathered here may already know that I am a cancer survivor. I know personally how devastating the diagnosis is, how frightening and uncertain your future seems at that moment. The natural things to do when you're diagnosed with cancer is to look for answers. You seek out information, you talk to your doctor and the specialist that they refer you to. You arm yourself with all the data you can to make informed decisions about your own health. I had lung cancer, a very common but deadly, but very well-researched disease. It's been studied for decades with a variety of relatively effective treatment options available to those of us fortunate enough to have access to health care. But the same cannot be said for uterine cancer. There's not nearly enough research into this disease and its causes. However, I'll venture to guess that if men had uteruses, the briefing book on uterine cancer might be a bit thicker. From the available data, we see what's been noted by our colleagues, that chemical hair straighteners are associated with a higher incidence of uterine cancer. What is often not seen, however, is the pressure our society exerts on black women to conform to beauty standards that are centered around whiteness. We're taught early on to straighten our hair, that in order to receive the same sense of belonging that white people are born with, we have to wrestle with our own DNA. Studies have shown black women's hair is 2.5 times more likely to be perceived as unprofessional. And we're 1.5 times more likely to feel like we have to wear our hair straight to a job interview to even be successfully considered. So in order to be viewed as more professional or to conform to the dress code, we are forced to fight with our hair as it comes out of our heads. There are fundamentally two problems at issue here today. The first and most direct is what my colleagues have noted, that chemical hair straighteners appear to be causing uterine cancer. The second is the underlying norms, pressures, and general atmosphere that makes black women more likely to use these products and therefore expose themselves to a greater risk of uterine cancer. I'm proud to support Rep. Clarke and Rep. Brown's bill to conduct more research into the relationship between uterine cancer and chemical hair straighteners. It's an urgent and necessary measure that will equip women with the information we need to make informed decisions about our own health. I'm just as proud to have my sisters up here today in the fight to beat back the stigma, the stereotypes, the Eurocentric beauty standards that have told us that we're not good enough as we are and that we need to change ourselves to fit in. We know natural hair belongs everywhere, and I'm so grateful to stand here with my sisters who recognize that. And with this, I want to turn it over to my classmate, slightly more seniority than I have, but a fighter nonetheless from North Carolina, Sister Alma Evans. Adams. Alma Adams.
Thank you so much to my sister from New Jersey, where I grew up. Yes, I do represent North Carolina's 12th district. I want to thank all of my colleagues for, first of all, for having taking the initiative to do this, for bringing a greater awareness to this issue. It is so very, very important. But I do represent the people of the 12th district in North Carolina. I'm also a black mother, a grandmother, and 3 weeks ago I'm now a great-grandmother. And I've been very fortunate in my life to have these blessings, but the life and new life of my family was not without hardship. My daughter nearly died giving birth to her daughter. And recently my granddaughter nearly lost her life giving birth to my great-granddaughter. So childbirth and what happens to women is very important. I do bring you greetings from the Black Maternal Health Caucus, of which I co-chair with Representative Underwood. So if we're talking about black women, black girls, black children, certainly it is an issue of mine. A woman's uterus is a sacred place and the foundation of all human life, and it should be the source of new life, not a life cut short. And so unfortunately, uterine cancer is one reason for this tragic twist of fate that too many women experience. And many of those women are women of color. And we can't ignore the connection between uterine cancer and women of color. And we can't ignore the connection that we've already made between hair care and what we put on our hair. And so I'm calling on Congress, along with my colleagues, to accelerate the research on uterine cancer, to find out why women of color experience it, elevated rates, and to discover treatments and preventative care. That is really important because we all deserve a chance to experience the joy of motherhood, of grandmotherhood, great-grandmotherhood too. So let's not politicize women's health. We're all in this together, and I'm so pleased to be here with my colleagues, and I'm introducing the gentlewoman from Chicago, from Illinois, Robin Kelly. Thank you.
Who lived in New Jersey.
And New York. You want us to
Hello, everyone, and thank you to my sisters, Rep. Yvette Clarke and Shontel Brown, for inviting me to speak today. And I proudly support the Uterine Cancer Study Act alongside my co-chairs of the Black Women and Girls Caucus, Yvette Clarke and Bonnie Watson Coleman, and just proud to be here with them. This legislation is a crucial step towards better understanding the relationship between uterine cancer and the hair products that so many women and girls use, including my 3 daughters. Black people, and especially women, have been systematically denied access to health care. Black women have been left out of conversations and decision-making about their health. By requiring the NIH, FDA, and HHS to explore this possible connection further, we can help address the environmental factors contributing to rising cancer incidence nationwide. This issue is particularly acute for black women, but we all know that, and I guess I could say what else is new. We cannot continue to allow the status quo to continue. We must take steps to address this issue. As you've heard, hair straightening products are heavily marketed toward women with curly and coiled hair. And as a result, almost every black woman in my life has used a hair relaxer at least once. Black women deserve to take care of our hair without being exposed to toxic ingredients that increase our already heightened risk of cancer. This legislation will allow researchers to pinpoint which ingredients are most harmful. It addresses a gap in knowledge and takes strides to increase participant diversity in research, which is critically important to me as the chair of the Congressional Black Caucus Health Brain Trust. Women of color have been historically underrepresented in research and often have unique exposures that lead to adverse health conditions. In order to minimize these disparities, we must promote and support diverse research initiatives to increase clinical trial diversity. This allows scientists to learn how new ingredients and therapies affect marginalized communities. As you've heard, in 2023, uterine cancer killed over 13,000 women. It is the most common cancer related to the female reproductive system. By passing this act, we can show that the federal government is treating this with the severity and urgency that it deserves. I am a proud supporter of this bill and urge my colleagues in Congress to support this legislation. Thank you.
Thank you.
All right, lady.
So let me thank my colleagues, Congresswoman Shontel Brown, Congresswoman Bonnie Watson-Coleman, Congresswoman Robin Kelly, and Congresswoman Alma Adams for their testimony here today, for their bringing to the fore the statistics and the data that we all know is impacting black women and girls across this nation. There are young children that will have their hair relaxed from a very early age and will continue through adulthood. We don't know what the impact of that will be without this research being done. And so let me thank my colleagues once again, for their leadership in all of their respective spaces and places. And we look forward to moving this legislation forward, for getting as many co-sponsors to this legislation and getting it to the desk of our president. With that, we will ask if there are any questions. Yes. It does not. Mm-hmm.
So it is our belief that with the collaboration of the NIH, the HHS, and the FDA, that they have the resources necessary to do the work. We just want them to bring their expertise together so that we can get the information and the data that we need to support what seems to be evident in our community. Mm-hmm.
Very well. Are there any other further questions? Well, seeing none, I want to thank everyone for braving the weather. And thank my colleagues once again for their support in pushing this legislation.